is Princess Cassandra Pimentel, a nursing student of National University near Totu. And for today's video, I am going to demonstrate passive range of motion exercises. So, before the procedure starts and before we handle patients, we must ensure to perform hand hygiene first and put some personal protective equipment if indicated. So in this case, I have already done hand washing and I put some face mask on. The first thing that we have to do before we enter the room is knock on the patient's door. And after that, greet the patient and introduce yourself, like this. Good day, ma'am. My name is Cassandra and I am your nurse for today. Verify your patient's information. May I know your name? And after that, explain the procedure to the client. So, today I am going to assist you while performing passive range of motion exercises. Is that okay with you? So before we get started, I am gonna provide you some privacy, so I'll gonna close this door. And that's it. So let's get started then. The first thing that we're gonna perform is the range of motion for neck. The patient is already high Fowler's position, so each of the range of motion exercise must be performed for at least 5 times. The first exercise is the neck flexion and extension. So for the neck flexion, let's bring the chin on 45-degree angle toward the chest and the head 45-degree angle to return to its position. Then bend the neck backward for 45 degrees and return to its erect position. That's for the extension. Front, back, back. So we're gonna do this for 5 times and perform each exercise for at least 20 to 30 seconds. The next exercise is the neck hyperextension. We're gonna do it for 10-degree angle. So we're gonna gently tilt the head going backwards. So we're gonna do this on the one side first, and then we're gonna do it on the other side as well. So 3, 4, and 5. And that is the hyperextension. The next is the lateral flexion. Tilt the head for 40 to 45 degrees. We're gonna do this by tilting the head toward each shoulder. Again, do it for one side first for at least 5 repetitions. Then on the other side. So 2, 3, 4, and 5. And next is the neck rotation. So we're gonna do this for 360-degree angle head rotation in a circular motion. So again, we're gonna do this for 5 times. And that is the passive range of motion exercise for neck. And then we're gonna proceed to the passive range of motion for shoulder. So make sure that the patient is already in a supine position for better performance. First, reposition the patient's pillow to get out of the way. And for your hand position, place one hand on the wrist and one on the elbow to support the movement. The first exercise is the flexion and extension. For flexion, raise arm from side position forward to above the head. And for extension, return to the side position. Return the position at the side of the body. So in this procedure, we're allowing the shoulder to move for about 180-degree angle. 4 and 5. The next exercise is the abduction and adduction exercise. Like this, for 180 degree. Going to lower the arms. So we're going the arm sideways and across the body as far as possible. So abduction, adduction, abduction, adduction. 4 and 5, and that's it. The next is the internal rotation and the external rotation. So again, one hand on the wrist and one on the elbow. So for internal rotation, the elbow is flexed and we allow the shoulder to rotate by moving the arm until the thumb is turned inward and toward the back. And for external rotation, move the arm until the thumb is upward and lateral to the head, like this. Internal, external, internal, external. 3, 4, and 5. So the next, if the patient is able to change the position from, for instance, is from supine position to Fowler's position, you can do the shoulder circumduction. So help the patient elevates her body into Fowler's position. So yeah, and perform the circumduction by moving the arm in a full circle motion. So do it for 5 repetitions. And I just want to add the hyperextension as well. So it is better if it is in a standing position. So if the patient is in a standing position, place the arm behind the back while keeping the back straight. Keeping the arm straight. So we're gonna do it for 45 to 60 degree angle. So position the arm behind and hold it for about 2 to 3 seconds and repeat the procedure for 5 times. So 4 and 5. That is the range of motion for the shoulder. So now we're gonna do the range of motion exercise for elbow and wrist. And the first exercise is the elbow flexion and extension. So we will do it for 150 degree. So flexion, extension, and the next is the wrist flexion and extension. So this is for about 80 to 90 degree angle. So we're gonna flex and extend. 3, 4, and 5. And after that is the hyperextension. So we're just gonna bring the dorsal surface at the back of the head. So hyperextension is like this. 3, 4, and 5. And the last are the radial flexion and the ulnar flexion. So for the radial flexion first is when we bend the hand upward the wrist medially toward the thumb for 30 degree angle. While the ulnar flexion is when we bend the wrist laterally toward the 5th digit. And after that, we're gonna do the range of motion exercise for fingers and thumb. So for finger flexion and extension, we're just gonna make a fist or close the hand of the patient and then straighten it back So this is how we do it. And the next is the hyperextension. So we're just gonna bend the fingers out backward for like 30 to 60 degree angle. So this is how we do it. And next is the abduction and adduction. So for the abduction, we're just gonna spread the fingers apart. And for adduction is by bringing the fingers back together. So like this. Abduction, adduction, abduction, adduction. And lastly is the opposition. It is when we position the thumb to each finger of the same hand, or rather on the middle of the palm, and bring it back. So this is how we do it. And after that, we're going to perform the range of motion exercise for hip and the knee, and after is the range of motion exercise for the ankle and the foot. So the first is the hip flexion and extension. So what we're gonna do is move the feet up for about 90 to 120 degrees. Hip flexion, extension, flexion, extension, flexion, extension. So the next is the abduction and adduction. So we're gonna do it for 30 to 50 degrees. So abduction is when we move the leg laterally away from the body, and for the adduction is by moving the leg back toward the media position. So repeat it for 5 times. Abduction, adduction. Next is the internal and external rotation. So we're gonna position one leg up and turn the foot and the leg away from the other leg, and do it on the other side as well. So do it for 5 repetitions. Internal rotation, external rotation, internal rotation, external rotation, internal rotation, external rotation. So in case that there are precaution that the hip shouldn't flex like that, do the other way around, with the leg straight, hands on the top, and rotate it in for internal rotation and out for external rotation. So like this. 4 and 5. And the next is for the ankle and foot. So what we should do is put over the knee, your knee, under the patient's knee for support, and hold the ankle with one of your hands. So we're gonna do the dorsiflexion and the plantar flexion. So dorsiflexion is by bending the foot back for 20 to 30 degrees and forth for 40 to 50 degrees. That is for plantar flexion. So this is how we do it. 1, 2, 3, 4, and 5. And our last range of motion exercise is for the trunk. So the first exercise is the trunk flexion. So this is by bending the trunk toward the toes for 70 to 90 degrees. So then bring the body back to its erect position for extension. Note that the extension and the hyperextension is different from each other. The next thing that we will do is the lateral flexion. So it is by bending the trunk from side to side. So hold the patient's shoulder for support. So do it for 5 repetitions. So the last is the trunk rotation. It is by turning the upper part of the body of the patient from side to side for 40 to 45-degree angle. So this is how we do it. 4 and 5. Range of motion exercises are done to preserve flexibility and mobility of the joints on which they were performed. These exercises reduces stiffness and will prevent or at least slow down the freezing of the joints as the disuse progresses and move less often. Range of motion exercises also prevent the development of adductive muscle shortening, contractures, and shortening of the capsule, ligaments, and tendons. In addition, range of motion exercises provide sensory stimulation.